Hello, my name is Julianna Posada. I will be changing my patient's peg feeding tube. So I will walk into my patient's room with my doctor's order. I would identify my patient. My patient matches my doctor's order. I will then introduce myself to my patient and explain the procedure I will be performing. Once I do that, I will raise the bed to a comfortable working position. I will then raise my patient's head to a 45-degree angle. Okay, so I do that. I will wash my hands, put my gloves on. Once I wash my hands, I will bring the side rails down. I will then assess my patient's peg feeding tube site, make sure there's no redness, it's not swollen. I will check if there's any extra drainage and make sure everything seems to be okay. In this case, the site seems to be okay. I will then assess all 4 quadrants for 5 minutes and check for bowel sounds, check if, make sure there's no nausea, no abdominal distinction. So I will put my stethoscope on. Once I do that for 5 minutes, everything seems to be okay. 5 minutes are up. I will then place a towel by my peg feeding tube. Put a towel there. I will turn my feeding pump off before I perform any procedure on my patient, so the pump is off. I have my tube kinked. I will then aspirate and make sure I don't have 100 cc's or more of my patient's content. If I would notify the physician, my clinical instructor, and I would not reinstall the contents into my patient. In this case, my patient does not have more than 100 cc's. Once I check the particles, I would check the color of it. I would see if there's any strange odor, and I would make sure everything seems to be okay before I reinstall anything. Everything seems to be okay. I will reinstall my patient's content. I will then kink my tube again. Close this. Once I do that, I will get 30 cc's of regular tap water. I have 30 cc's of tap water. I would kink my tube. Install 30 cc's. I do that. I will kink this again.
So you know what? I thought that it's on my shirt.
Make sure everything's okay. I will turn the feeding pump on again so that my patient can get the feeding. Make sure the feeding pump is okay. The normal amount of food is installed. Then make sure everything seems to be okay. Once I do that and the feeding pump is on, I will take my towel away, throw the towel in the garbage. Bring my patient back down to the lowest position possible. I will remove my gloves, throw them in the garbage, wash my hands. I will then document the input and output data I receive from my patient and have the call bell on site so that my patient can call if there's any emergency. Okay, thank you.